Hi, my name is Jessica Norman and I'm one of the advanced cardiac rehabilitation nurses working in North East Wales. Thank you for watching this video. Hopefully, once it's finished, you will understand what causes heart disease and you will know what you can do to prevent it from developing. The heart is about the size of our own clenched fist and it sits in the centre of the chest, although it does tilt and rotate to the left. The heart is a muscle with its main job being to pump blood around the body. The right hand side of the heart pumps blood to the lungs to pick up oxygen. That oxygenated blood then enters the left hand side of the heart, which then pumps it round the whole body, delivering oxygen and other important nutrients to the body's organs. Because our heart is a muscle, it needs its own blood supply, which is delivered through the coronary arteries. Over time, these arteries can develop fatty deposits within the walls, also commonly referred to as plaque, narrowing of the arteries, heart disease, and atheroma, which is derived from the Greek meaning for porridge, which helps us to visualize what this plaque actually looks like. Heart disease usually develops slowly over a long period of time, with symptoms occurring when the plaque starts to restrict the flow of blood to the heart muscle itself. A heart attack is most often caused by a plaque rupture. This is when the atheroma surface cracks or breaks off, resulting in the formation of a blood clot, which essentially is trying to repair the vessel wall, but subsequently causes a blockage within the coronary artery. A heart attack is often described as a pain, discomfort, tightness, or heaviness in the chest that occurs suddenly. It may spread to the left or right arm, sometimes both, as well as the neck, jaw, back or stomach. People often experience breathlessness, nausea, vomiting, or can feel sweaty or clammy. It is important to note that everyone will experience heart attack symptoms differently, and some people may have no symptoms at all. Care should be taken with elderly people, women or diabetics who are more likely to develop different kind of symptoms. Angina is also caused by heart disease, which results in restricted blood supply to the heart. Although the plaque is more stable, angina may present with similar symptoms to a heart attack, but they are often milder in nature. When stable, angina usually occurs on exertion and will be eased with rest and/or use of the GTN. Cold weather, feeling upset and consuming a heavy meal can all trigger angina. If the angina symptoms are occurring at rest or not being relieved with GTN, you should phone 999. If you have symptoms that last 10 minutes, whether you have tried your GTN spray or not, it is time to call 999. If your symptoms are severe, you should not delay. Call immediately. Please, we want to check this out for you. There are several different treatment options available for heart disease. These include percutaneous coronary intervention, also known as stenting, coronary artery bypass graft surgery, medication, which is given to everybody usually regardless of what other intervention has taken place, and lifestyle, which is often overlooked but is vital in reducing our risk of heart disease. I will now discuss the different lifestyle risk factors for heart disease. First, let's think about our non-modifiable risk factors. These are things that we have no control over in our lives. Age. The longer we live, the more time there has been for plaque to build up in our arteries. Gender. Men have a higher risk of heart disease, which usually occurs at a younger age to that of women, although women are actually twice as likely to die from heart disease than breast cancer, despite being lower risk than men. Ethnicity. If you are South Asian, you are more likely to develop coronary heart disease than white Europeans. And genetics. A strong family history of heart disease is when someone in your immediate family, a male under the age of 55 or a female under the age of 65, have previously been diagnosed with heart disease. Modifiable risk factors. I'll now talk about some of these. These are things that we have some or full control over. Smoking is still one of the biggest risk factors for heart disease. Around 14.1% of UK adults currently smoke, with a further 5 to 6% of the UK population using e-cigarettes. Quitting smoking is the single most important step you can take in protecting your heart health. After 1 year of quitting smoking, your risk of a heart attack has halved. Obesity. Although smoking seems to be on the decrease in the UK, obesity is certainly on the increase. Around 64% of UK adults are overweight or obese, with 30% of children in the UK falling into this category. Obesity has almost doubled in the last 20 years. We must make changes as a nation to tackle this if we are to continue to fight against heart disease. Although there are many reasons for obesity rates increasing, physical inactivity in the UK is responsible for 1 in 6 UK deaths, equal to that of smoking. It is estimated that 38% of UK adults do not meet the UK recommendations for exercise. In Wales, that's 47% of UK adults. We should be aiming for at least 150 minutes of moderate intense exercises a week. Diet also plays a part in our heart health. Although it is estimated that only a quarter of adults in Wales consume the recommended 5 portions of fruit and vegetables per day, everyone should aim for a well-balanced diet with plenty of fruit and vegetables, some meat, fish, eggs, beans, and other non-dairy sources of protein, with options of low fat, salt and sugar where possible. Alcohol is also a huge risk factor for heart disease, but unfortunately 1 in 5 adults drink more than the weekly guideline amount, which is no more than 14 weekly units. It is important to note that no level of alcohol consumption comes without risk. Diabetes increases our risk of heart disease, with nearly 200,000 adults in Wales being diagnosed. Almost 1/4 of patients attending cardiac rehabilitation have diabetes. A healthy BMI, along with regular exercise and eating a healthy, balanced diet, will control or reduce your risk of developing diabetes. High blood pressure, also known as hypertension, is prevalent in approximately 28% of UK adults, although more than half are thought to not be receiving effective treatment. If your blood pressure is 140/90 or higher, you will need to get it rechecked several times, and you may need medication. After a heart attack, your blood pressure may be lower than this when taking your medication. High cholesterol is another significant risk factor for heart disease. After a heart attack, we aim to bring your bad cholesterol, your LDL, to below 1.4, sometimes lower. And you will probably be started on statin therapy for life. You will need to take this for at least 6 weeks before rechecking your cholesterol levels. Stopping smoking, exercising regularly, and reducing your alcohol intake, as well as eating a healthy, balanced diet, will help reduce your cholesterol levels. Finally, stress has been linked to the development of heart disease. Not only is it associated with unhealthy habits such as smoking, drinking alcohol, and choosing unhealthy foods, but it has been found to directly affect the process of atheroma buildup in our arteries. Eating well, being active, and getting enough sleep will all help to combat stress. If you feel that you need support with one or more of these risk factors, cardiac rehabilitation can help to support you. You will find where your nearest cardiac rehabilitation program is online, the details of which will be displayed at the end of the video. Further information can also be found on the British Heart Foundation website. Coronary heart disease is the leading cause of death worldwide. There are around 7.6 million people living with heart and circulatory disease in the UK. With an ageing population and improved survival rates, we could see these numbers rise further. Despite the prevalence of heart disease, the UK death rate from heart and circulatory disease has declined by more than 3/4 since 1961. We will continue to fight against heart disease together. Thank you.